Thank you so much for joining us. I'm so thrilled to have you here and really excited to have this conversation.
My name is Jen Kuhl. I work with the Global Climate and Health Alliance. And today I am joining the chat from West Moberly First Nation, which is in Deneza territory on the western edge of Treaty 8, which is in what's more commonly known as BC. And incidentally, this part of the world and this part of the country, Treaty 8 includes the third largest deposit of hydrocarbons in the world. And so we are like surrounded on both sides, lots of gas development on the west side, development and pipelines. And then we have Alberta's oil sands to the east of us. So the subject matter of this webinar feels very extra pertinent today. And I'm really grateful to everyone for joining us.
Very quickly, our agenda for the day, I'm going to start by giving an overview of the health impacts of fossil fuels, and then I'm going to turn to Harjeet from the Fossil Fuel Non-Proliferation Treaty, who's going to give us an introduction to how the treaty works and what the role the health sector can play in it. They'll have a little bit of time for questions, and then we're going to turn to two groups who have been real leaders in calling for fossil fuel phase out to protect health. We're going to hear from Lalitha and Marjane from Physicians for Social Responsibility, who have truly led this process and been a huge part of drafting the health endorsement letter. And then we're going to hear from Shweta from Healthcare Without Harm, who's going to give us a picture of how the power of health workers in conversations about fossil fuels. And then we'll close out by sharing some next steps.
And with that, I'm going to jump in to sort of where this came from for us for GCHA. So as many of you will remember and took part in, a big push last year was the Healthy Climate Prescription Letter. Many health groups came together to draft that letter, and then 600 health organizations representing over 45 million health professionals signed on calling on governments to take action. It was a huge and powerful effort that really grabbed global attention. And I think also was a real opportunity of health people coming together and recognizing what a huge challenge and problem climate change is going to be. And we also, with that letter, saw sort of the accompanying report from the WHO with making the health argument for climate action. We saw incredible action by cyclists who carried the letter all the way from Geneva to Glasgow. And we saw this huge push from many of you to really bring the health voice to the COP. And there were 4 asks in the Healthy Climate Prescription, 4 things that health leaders and health workers around the world were recommending to protect the health of current and future generations. And a big one was fully and justly phasing out fossil fuels, starting immediately. And after some deep thought, deep thought, and also then looking at this incredible opportunity ahead of us, many health partners, GCHA included, really felt like the Fossil Fuel Non-Proliferation Treaty was a really excellent way to action that point. It's not the only way that the health community can take action around fossil fuels. It's not the only way we can use our voices to powerfully speak against this major issue that is impacting people's health, but it's a really important one. And so we feel like this treaty, being involved in the treaty process, is really just an extension of the calls so many have already signed on to in the Health Climate Prescription Letter last year. I'm going to take a very, again, deep or very brief dive into some of the really concerning health impacts of fossil fuels. Again, I know many of you know them. I know many of you talk about them all the time, but in case we have some folks who are new to this space, I just wanted to recap some of the major health impacts that the health community is concerned about, and that also ended up being a major part of what I think the health sector is bringing to the treaty process. So right off the top, we know that before fossil fuels are causing climate change, they're polluting the air. Maria Nera says it all the time, 7 million people a year are dying from air pollution. And I was involved in a report, working on a report with the Canadian Association of Physicians for the Environment. And we only looked at studies looking at traffic-related air pollution, which of course is fossil fuels, and the impacts on people's respiratory health, their neurological health, their heart health were startling to me. Just the huge amount of evidence that is available showing these major health impacts. And so again, air pollution, there's so much to be gained by phasing out fossil fuels in terms of protecting people's health from air pollution. And just want to make sure I credit the WHO for both of these excellent infographics, including the moving one. Of course, we also know there are massive health impacts of climate change, and fossil fuels are the major contributor to climate change. I wanted to pull out two that have really stuck with me. One was I was about to travel to a really incredible conference on climate change in South Africa. And I had remembered there was flooding in Malawi a few years ago, and wanted to look up what the numbers were for that. And when I searched flooding in Malawi, I found new news of flooding in Malawi, where again, hundreds of people had been displaced, many people had been killed, and 19 health centers had been disrupted or destroyed. And so we know climate change is directly impacting the places where health community folks work, where they practice, and it's impacting their patients' lives. I also, another big impact of climate change is heat. Usually when I live in Vancouver, and last year we had this incredibly brutal heat wave that killed 600 people in the province, a town caught fire. It was astonishing. And those two major stories are just two of the sort of extreme weather events in this broader context of things we know about increases in vector-borne disease, in water-related disease, and in displacement of people and mental health. And then finally, one thing we don't talk about as much as we talk about the other two are some of the health impacts for communities who are in the proximity to where extraction of fossil fuels, gas, oil, and coal, where that extraction and processing and transportation is taking place. So this photo is from the Alberta tar sands, and we know that communities that are close to oil development have some very concerning health impacts, particularly around birth and respiratory health. But there's challenges for health all the way through the process. We know there's risks of pipeline leaks that can poison rivers and air. And we also know that it's really challenging to clean up these projects. This is a photo also from northern Alberta. And that's a reclamation site of land that has been used for oil extraction. And seeing it makes it challenging to believe that those places could be reclaimed for nature again. So again, because we see these huge, extensive health impacts of fossil fuel use, it seems really important to do everything that we can to phase them out and end expansion. And so that has brought us to coming together with a group of really brilliant folks, including Marjane, to draft a letter in support of the Fossil Fuel Non-Proliferation Treaty from the health community. And we will tell you a little bit more about that later. I think Harjeet can also tell you about some of the other groups that have endorsed, and can also tell you a bit more about how the treaty works. But I just wanted to sort of lay the groundwork for why we as the health sector think this is really important. And with that, I will pass it over to you, Harjeet.
Thank you so much, Jen. I hope you can hear me properly.
Yep.
Okay. So you've set the context really well. Let me start with sharing a bit more about the treaty. So let me share my screen. Can you see my screen? And is it full screen?
It's not full screen. It's your Windows full screen, but there you go. Now you're on presentation.
Okay. So Jen has already talked about the treaty very briefly. Let me go a bit deep into that. It's a bold project to phase out fossil fuels and support a global just transition. Before I go deep into it, let me just share a bit of background on how it started in terms of history. So this is not an idea that we came up with. So that it has been simmering for the last few years. So Pacific countries came up with an ask that there should be an international moratorium on the development and expansion of fossil fuel extracting industries and new coal mines in 2015. And then Lofoten Declaration particularly talked about what is needed in terms of climate policy and governance to talk about a managed decline of fossil fuel production and also a just transition. And I'll talk why we need a managed decline of fossil fuel production in a bit. And then in October 2018, Peter Newell and Andrew Sims, who are academics at the University of Sussex, actually renewed a call. They came up with a whole comprehensive concept of fossil fuel non-proliferation treaty. We know that the 81% of energy is being used from fossil fuels, and the demand has not or the proportion has not changed, and the demand is now much more greater. And we have seen what's happening in terms of the war in Ukraine. So instead of reducing fossil fuel extraction, we have seen it is now on the rise, while we are talking about increasing renewable energy as well. So then in September 2020, so it's about 2 years now, we launched the Fossil Fuel Non-Proliferation Treaty Initiative at the Climate Week in New York. And this is where the campaign for the Fossil Fuel Non-Proliferation Treaty actually started. And the reason for that, as Jen mentioned, fossil fuels are responsible for the crisis. But if you look at, and we have been knowing about it for decades now, but we are not really tackling the problem head on. In fact, the UNEP production gap report says that if we continue with the production, which is going to be now as business as usual scenario, it's going to be more than double the production, which is consistent with 1.5 degrees. So on one hand, as global community, we have set the target. On the other hand, we continue with the fossil fuel exploration and expansion that is not inconsistent with the target. Now, when we talk about the current projects ongoing itself are going to blow up the target of staying below 1.5 degrees. So the whole carbon budget, there's going to be only 50% chance if we continue with business as usual. And if we do not have a global agreement on fossil fuel production, then there are several risks that we anticipate. Of course, the transition is going to be much more harder. And if we continue to invest, if we are going to have more stranded assets, and we'll see more financial turmoil in the next few years. There's also risk to workers and communities who will continue to remain dependent, which means that support that they need now to transition to greener jobs will be delayed. And like what's happening right now, we will see that renewable energy expansion is also going to delay further. What is needed absolutely is economic diversification, especially for countries whose economies are massively dependent on fossil fuel extraction. And more delay means that we are going to be making the pro-fossil fuel political constituencies much more powerful and stronger, which is going to further delay the transition that is urgently needed. And we'll see a lock-in in terms of technical, economic, legal, and political, as I explained. Another danger that is looming, and there's already a discussion on geoengineering. So on one hand, as Jen was saying, we are facing climate impacts. So there's a call for climate emergency and such actions from the government. So instead of reducing dependence on fossil fuels, we are going to see calls for geoengineering in the name of tackling climate emergency. And we know that many of these so-called, we call them dangerous distractions, are going to further delay the real action that is needed, which means that warming is going to go way beyond 1.5 and 2 degree Celsius. Now, it's not just us who have been saying, or civil society organizations. International Energy Agency, which has been very conservative in its approach so far, has also said very clearly that there is no need for investments in new fossil fuel supply if we want to really be on that net zero pathway. And UN Secretary General, the IPCC report that came out, in fact, last year, he said that it must sound a death knell for coal and fossil fuels before they destroy the planet. And recently, after the Working Group 2 and 3 report, he has launched a scathing attack against fossil fuel industry. But the reality is, despite all the awareness and knowing what the problem is, the Paris Agreement does not mention coal, oil, and gas. We have seen recently in 2021, Glasgow Climate Pact, when it was agreed, there's a weak mention of unabated coal, and it doesn't even talk about oil and gas. And it doesn't really talk about how we are going to manage the fossil fuel production globally. Now, when we talk about the need for a global mechanism, and particularly when it comes to supporting countries for in the form of international cooperation, if you see these countries on this chart, on y-axis, it's about capacity to fund just transition, and on x-axis you see the oil share of government revenue. As I was saying, that many governments are dependent on fossil fuels for their revenue, not just for energy. So what we have been seeing at the global level campaign that talks about 2050 as the net zero target, where we talked about equity and asked developed countries to do it much, much earlier, so that developing countries can take a few more years, but they also get support to reach that target. And this chart actually explains why we need equity and why we need international cooperation. If you look at the US, Canada, and UK, the GDP per capita they have, and also compare that with the share of revenue they are getting from fossil fuel production, oil in this case, it's almost negligible, or 1 or 2%. Whereas if you look at countries like Timor-Leste or Congo or Azerbaijan, more than 50% of their revenues come from oil, and their GDP per capita is below $20,000, which means they have little capacity to make that transition, but they are far more dependent on fossil fuel extraction. And similarly, you look at case of Nigeria, Angola, Chad, or Bolivia. So it clearly tells us who needs to do how much, and how much they are dependent on the revenue, and what kind of capacity do they have, and what role they must play internationally by supporting developing countries to make that transition, and who needs how much support in making that transition. So this is where the Fossil Fuel Non-Proliferation Treaty comes into picture, where we have drawn from the nuclear disarmament treaties. So based on that, we talk about non-proliferation, which means that we do not want to further add to the problem, which means no new exploration, no expansion into new reserves. And when it comes to disarmament, here we talk about phasing out of fossil fuels in a more equitable and just manner, so that our target is in line with 1.5 degrees. And a just transition, which is needed for workers and communities. So on one hand, it has to be equitable, but how we support countries in making that transition much more just. And this is where we need a comprehensive global mechanism in the form of a treaty, so that we can have a rapid, coordinated, transparent, and equitable transition. Our objectives: so one, we want to change the global norms on fossil fuels by demonstrating widespread action. So right now, the Paris Agreement focuses on the demand side, but not on the supply side. And there is no anchor on how much production fossil fuel industry can continue with, and how they have to stop a new exploration. So we need those global norms, and there's a framework that is missing, which must call for multilateral agreement and for just transition. So right now, just transition is mentioned only in the preamble of Paris Agreement, which is nowhere near what is needed to operationalize just transition in countries. Recently, there's talk about just energy transition partnerships. So there was an announcement in Glasgow to support South Africa, but trust me, there's no clarity where the money is and what elements it's going to support, whether the money is going to go to workers and communities or to energy companies. So we need that framework. And of course, there's a movement which we want to be part of and contribute to in terms of just energy transition, particularly talking about equity and justice, putting it right at the center. So how we are achieving these objectives, we are motivating cities and states to endorse the treaty. There has been a strong support from civil society organizations, and I'll share some numbers in a bit, and how to increase transparency and accountability by developing research on fossil fuel expansion. So this is where we are talking about the global registry on fossil fuels, and how do we work with and complement frontline and finance campaigns so that we have a more political demand to respond commensurate to the scale of the crisis. So we now have about 1,500 organizations who have endorsed the treaty spread around the world. In terms of our theory of change, so as I shared, it's just about 2 years, and we are right now working towards enabling conditions for a global movement, which means having a more groundswell of that demand. And this is where our work with the health community comes in. So far we have been working very closely with environmental, faith, peace and security, youth, indigenous, and women's groups, and we want to intensify our work with the health groups here, and how we shift the narrative in terms of communication strategies, where we have to talk about how do we phase down and phase out fossil fuels. It's about enhancing accountability and transparency, and this is where I was mentioning that we need transparent data on fossil fuel production, demanding a global just transition, which I shared, also increasing political pressure from below. And this is where our work with cities and subnational becomes really important. Very recently, London endorsed the treaty, and there's a demand again. Ottawa endorsed the treaty. So many cities around the world are coming forward. And so there's going to be an increased political pressure that will get created from these cities and subnational governments. And at the same time, we are working on building the evidence base. We recently released a report on how it's connected with all sustainable development goals, which we launched at Stockholm. And of course, working with many other organizations and complementing their theories of change, be it work on the front line or many financial campaigns. So as I shared, we have 1,500 plus organizations, 3,000 plus scientists, about 300 nationally elected parliamentarians, 101 Nobel laureates, and now 55 cities and national governments. Jen referred to those letters. So we, again, to build momentum, we have had a series of letters that we have launched. So academics came together to support this letter. About 3,000 academics endorsed the call for a treaty. And we had big names like Michael Mann and 101 Nobel laureates who supported the 3 pillars of the treaty. Again, there was a letter that was endorsed by the Nobel laureates. We also had young activists who launched call for a fossil fuel non-proliferation treaty, and how they equated coal, oil, and gas with weapons of mass destruction. We also had Parents for Future supporting the call for a fossil fuel treaty. And as we speak, we also have an open call where faith leaders have come forward and faith-based organizations who make the moral case for a global just transition away from coal, oil, and gas. So this is an open call where many faith-based organizations and leaders are signing this. As I said, there's a call from parliamentarians. So this has become actually an initiative of its own now. So they are in the process of setting up a secretariat, and where 300 plus nationally elected officials from 65 countries are calling for a fossil fuel free future. And they have been advocating for it. And again, that creates that kind of groundswell where they'll be influencing their own governments as well. So these are the parliamentarians from the global south who have been leading. So these parliamentarians are from Malaysia, Philippines, Colombia, Indonesia, Pakistan. In terms of our diplomatic engagement going forward, as I said, we have created this groundswell, but at the same time, we are increasing our diplomatic engagement. So ideally, we would like to see a club of countries who demand for it, and we have got some traction. So in fact, the elections in Colombia really had a positive result where the president has called for phase out from fossil fuel, which is massive. So Colombia as a country, and we have been in touch with him even prior to election. So we will be working very closely with countries like Colombia. We're also working with many countries in the Pacific, also in Africa, so that we have a group of countries who demand and make sure that they create that kind of momentum that is needed to establish the treaty. Global registry, which I talked about, and I'll say more on that in a bit. We are also working with partners and allies to demand a global commission on fossil fuels, or there could be a UNSG report. And the way UNSG has been attacking the fossil fuel industry, it's quite likely that we will be getting support from him. And of course, everything then leading to the treaty that has those three pillars of stopping new exploration and production, and phasing out fossil fuel, and managed and just transition. This is more on the research, what we are doing. I think I can skip that for now. But we have done a series of reports. So fossil fuel exit strategy, fossil fuel 5, where we talked about how 5 major countries are increasing their oil and gas production. And in terms of the registry, so basically this is about building the evidence base so that we have a more comprehensive source of data on fossil fuel reserves. Right now, we depend on private companies and not an open source data. And this registry is going to make it more publicly accessible, the data around production and reserves, and which will eventually enable policymakers, investors, and civil society to demand the action, and particularly based on the climate risks. And this will also inform the finance and investment decisions. This will create domestic pressure and ultimately call for international cooperation and global norms, and call for just transition. This is again a bit more on how it works. We also engaged massively at Stockholm Plus 50, where for the first time there is a mention of phase out of fossil fuels and to recognize the need for financial and technical support to realize just transition. So we have been intervening in several spaces. So in this case, I'm sure many of you attended the calls where we were coordinating engagement with the governments and engaging in the leadership dialogues and providing input so that we can influence the text. And we were pleased to see this kind of a mention, which is for the first time fossil fuels have been mentioned in a UN agreement. And of course, we wanted to go far enough and also talk about global mechanism. But yes, so this does provide us a hook to move forward and demand for a global framework. So yeah, what you can do, you can endorse the treaty, you can promote the video, and you can call on cities and subnational governments in your region to endorse. You can also sign letter. And health, yeah, now I should update, the health letter is out now. So, and then of course, inviting parliamentarians and nationally elected officials to join the call. So that's about the treaty, and I'm going to stop here. We also have a campaign hub on the website, so you can check. Thank you.
That's awesome. Thank you so much, Harjeet, for that incredible overview, and also for walking us through how it happens. And one thing I just want to reiterate, because we do get asked this a lot, is there are some sign-on efforts or some sort of like global consensuses that that don't have a formal engagement process with governments, but the treaty very much is working on a process to have this be led by governments, right? Where like even that's part of the reason the treaty organizers are not drafting the text. Is that true? Because we're leaving it to the governments who will propose that?
Absolutely. That's an excellent question. And also reminds me I should talk about the principles of the treaty that we are right now in the process of developing. In fact, we are just initiating that process and we will be reaching out to you. So the reason you're absolutely right. The reason we are not drafting the text because we want governments to lead and own that. Of course, we have those three pillars which form the basis for the treaty. But we want to take a step further than that. We want to set up the principles and not a desktop exercise. Of course, we'll do research and look at what kind of principles that exist across various treaties and agreement, but that will just be the basis. And we will then do consultations with various constituencies like health, faith, labor, and so on, youth, indigenous people to get inputs, and also in several regions, so that we have all these constituencies and policymakers engaged to contribute to at least form again another step to create principles of the treaty, and then government should take a leaf from that and develop the treaty further. And there'll be far more ownership of the treaty if they lead on it. If we just provide it on a platter, we know how governments operate, so they're not going to accept that.
Thank you. I just want to leave a moment in case anybody has further questions they'd like to ask. You're welcome to either write them in the chat or raise a hand. Just while we give people a moment to do that, I'm going to share. Okay, good question, Mark. The health call, you are the first to formally, there we go. You're the first people to see the health call and to get the link. So the health call is, here we go, I'll share my screen. Can you see my, there you go, okay. Yeah, this is the first day that it is live. You will be the first group of people to get the link to sign and to share with your organizations. And I just want to again highlight that obviously lots of the text in this is very health-y, but the three calls are the same across the board. Those are sort of the three principles that everyone is recommending. So we will drop that link in the chat shortly. We've got a question about whether the Club of Rome is a good ally. Is that a question you can answer?
Yes, it is, and we did engage with them a while ago. Have not been working actively with them, but absolutely, they are an ally.
Awesome. Sue, I've got half of your question. Do you want to? Oh, what has the response been from the fossil fuel industry, and are you working with them at all in this process?
No, we are not working with the fossil fuel industry. We are working against them. We know that they are the ones who have been, creating this disinformation campaign. So they are very well aware of science. They're very well aware of what they need to be doing. So we are not engaging with them directly, but we do want to initiate our engagement with corporations who are in the renewable energy, who are part of the solution. And we do want to encourage them to endorse the treaty, but not as greenwashing, but when they genuinely believe in it and take action. So that stream of endorsement is going to start. And for industry, industry has to phase down and phase out absolutely immediately. We know that how we continue to remain dependent on fossil fuels. So yeah.
Yeah, let's go ahead.
On COP27. So on COP27, of course, we will be engaging, but that's not the only place. We will have massive engagement. So right now, the policy hook that exists is the mitigation work program that we got at COP26, which we will take to COP27, where we want to get the fossil fuel language mentioned much more strongly, and particularly just transition. So at COP26, as I was mentioning earlier, we got a mention of coal and that to unabated coal, and now oil and gas. But the mitigation work program provides us the opportunity. So we will be, we are already following that process and we'll be contributing to that. So that remains a hook for us. And of course, a lot of things happen around the COP. So basically the discussion on just transition, as I said, the partnership that are being talked about, which has no model, but yeah, there's a lot of talk about just transition now for support for India and Indonesia, and a lot happens at the COP in terms of taking it further.
Thank you. With that, I'm going to turn it over to Lalita and Marjane from Physicians for Social Responsibility, who again were a huge part of making the letter happen. Over to you.
Thank you so much, Jen, and thank you so much, everyone, for being here today. My name is Lalita Sirpaneni, and I'm a practicing internal medicine physician. I'm an assistant professor in general internal medicine. I currently practice as a hospitalist in Minneapolis, in Minnesota, on occupied Dakota lands. In addition to my work as a clinician, researcher, and educator, I'm also on the board of Physicians for Social Responsibility. And I spend my time away from the hospital organizing and advocating for clean climate policies that also benefit public health. Thank you so much to my co-presenters for outlining the health impacts of fossil fuels, as well as the need for to phase out fossil fuels. So in the past several months of reading the literature and writing about this topic, I think one of the biggest takeaway for me was how we've been conditioned to ignore the health toll of fossil fuels as an acceptable price that we pay for development. Across the world, the worst of these health impacts of fossil fuels are being displaced onto certain communities who are essentially being designated as sacrifice zones so that the fossil fuel industry can continue business as usual. So as we reflect on this, I wanted to take a minute to share a story from my childhood. Jess, if you could advance a slide, please. I grew up in Southeast India in a coastal city called Vishakhapatnam. And in September 1997, one Sunday morning, there was a loud boom and our whole apartment shook. I remember that there was a vase on the television that fell to the floor. I thought it was an earthquake. Next slide, please. In fact, we would soon find out that there was a massive explosion at a petrochemical facility. As the day progressed, the sky became smoky, even though my house was quite far away from the site of the explosion. I remember the very tense mood that day as my parents and my neighbors tried to find out more information. That night, it rained heavily, and then when we woke up, we found the plants were all covered in black soot. Official numbers noted that around 60 people died and around 70,000 people in the vicinity of the explosion fled their homes. We didn't know what happened because most of the workers who were on site that day died in the explosion. I remember the stress we felt over the next week as a community as we tried to figure out if there was going to be another explosion. Some of the older students in my school had volunteered to be part of the rescue efforts. And I still remember vividly the horrific stories they shared of the carnage at that scene and the trauma that they had suffered. I really wish that I could say that that was the last accident that the community faced. But as we heard today, it's this impacts of fossil fuel pollution don't just stop at accidents like these. We know that every stage of fossil fuel extraction, drilling, refining, and end use pose a risk to our communities. Jess, you could stop the screen share, thank you. Communities where these facilities are placed, as we heard, are often low-income communities and communities of color and are especially at high risk. We know that health impacts of fossil fuels, 1 in 5 deaths worldwide is from fossil fuel pollution. And as a practicing physician, I see my patients being hospitalized for lung problems like COPD or asthma on days of high air pollution and heat. I refuse to accept that as physicians, as public health professionals, like the best we can do for our patients is take an inhaler in their hand and send them right back into polluted environments that cause their health problems in the first place. It's our moral responsibility to speak up to protect the health of our patients and communities against the harms of fossil fuels, including climate change. Next slide. As we know, action on global climate change is local. So in Minnesota, I'm a member of Health Professionals for a Healthy Climate, and I wanted to share a couple of ways in which health professionals are advocating and making sure we communicate with our lawmakers about health impacts of climate change and air pollution. So as you see here, we've created some briefs or white papers on the health impacts. So for example, diesel exhaust on children and the health impacts of tar sands oil pipeline. And this is a letter that was with liquefied natural gas was with the Physicians for Social Responsibility. We also are educating other health professionals within our state through educational webinars. Next slide, please. We have many other efforts, including grassroots organizations, so that we bring in other health professionals into this work. Many of our members are involved in public testimony, social media campaigns, share the message on health impacts of climate change through traditional media. And when there's no opportunities to meet with lawmakers, we've created our own, which is this teach-in at the governor's office. Next slide, please. We are in our work. This was a powerful moment of advocacy. There was an oil pipeline that was being built in Minnesota, tar sands oil pipeline, and several chapters across the country of Physicians for Social Responsibility and Partners in Coalition from Medical Society Consortium came together and on one day to ask for the permits for the pipeline to be rescinded. Next slide, please. The one other, I also wanted to share that when we advocate for solutions, we are supporting community-led solutions like clean energy. We were successfully advocated to our pollution control agency for funding for electric school buses and partnering with organizations on mobility justice, so that this is not just about electric vehicle ownership, but the community coming together to create a vision to reclaim the streets. As health professionals, we have a chance to support our communities and design climate solutions that make them resilient, self-reliant, safe, and healthy. And when seen through the lens of public health and health equity, it's clear that in order to protect our health, we need to phase out fossil fuels, and we need a just transition to a future with clean, healthy, equitable, renewable energy. Thank you so much for your time and for the opportunity to speak.
Hi. I'm Marjana Moini. I'm a volunteer physician for Physicians for Social Responsibility. And I just wanted to start the conversation by recognizing that the health harms of climate change, air pollution, and residential proximity to fossil fuel operations are not equally distributed. The burden is primarily carried by communities who are least responsible for greenhouse gas emissions, like Global South, communities of low income, people who experienced racial and other forms of discrimination, youth, and indigenous people. A big part of our population is trapped in overpolluted neighborhoods. And one example of policies that have led to these built environment is neighborhoods defined by residential safety maps or redlining in US. So this was essentially racist mortgage appraisal practices. Today's oil wells are twice as frequent in these residential neighborhoods. The air pollution is much worse in these residential neighborhoods. And the average temperature in the summer is about 5 degrees higher in these residential neighborhoods. But the good news is that climate solutions, many of them have very important, very significant and immediate health benefits, and they can also promote and address the health inequities. They can fix the health inequities. But unfortunately, we're also dealing with a lot of misinformation by fossil fuel companies and false climate solutions, otherwise known as loopholes or climate dead ends. Carbon capture, utilization, and storage is something we wanted to discuss today because it's getting a lot of traction, and unfortunately, a lot of countries, a lot of governments are planning to spend a lot of public fund on subsidizing these projects. So carbon capture, utilization, and storage, or CCUS, has several steps. The first step is that it captures CO2 from an industrial source. So by definition, it doesn't capture pre-existing CO2. It has to be kind of attached to another source of emission. It separates the CO2 from other gases, compresses it at high pressure into liquid CO2, and then transports it through these pipelines into a storage site, injecting it in high pressure into the storage site, where it's supposed to be sealed indefinitely without any possibility of escaping. The U stands for utilization. So because this process is very energy intensive and very expensive, actually about 80% or majority of CCS projects or carbon capture projects actually capture CO2. So then to then inject it into the to the ground for enhanced oil recovery. So this actually this process that some governments are up to subsidizing is planning to actually kind of get more oil out of the ground. This is from a marketing infographic from a fossil fuel company, and you can see how they have all these, fictitious kind of usage you can have for CO2. But you can imagine CCS costs about $100 to $200 a ton for captured CO2. Sparkling water is not going to make up for that much profit. So these are not going to be used for, this type of projects that are still kind of unnecessary. What is really critical to know for public health professionals and students is that this is another set of, public health risks that are being introduced through carbon capture and storage technology. So at every stage, at every step of the way, from the capture to the transport to the storage, CCS exposes public to grave health harms. First of all, as I said, this is very energy intensive process. Every step of the way, there is an energy source that has to be used for capture of the CO2, for transport, for turning into liquid CO2, for transporting it, and for injecting it into the ground. These sources of energy are dirty fossil fuel sources. They're not clean energy. They're not using renewable energy to support CCS. These are projects that are funded by fossil fuel companies with massive public subsidies. They're not going to be using renewables. So they're actually using dirty energy. It's quite absurd. It's unbelievable. But for example, they burn gas to capture CO2 from a coal operation to then get that CO2 to then inject it into the ground to dig out more oil. So if you think about it, really is crazy. But essentially, what these energy sources do is that they increase emission of all the other pollutants that you know of, nitric oxides, particulate matters, ozone, volatile organic compounds, everything that causes a lot of health harms. The other thing is that these operations are kind of running adjacent to another polluting industry. So they're not capturing CO2 from just air, they're capturing CO2 from an industry that's emitting pollution like a power plant or refinery. So these power plants and refineries themselves emit other pollutants other than CO2. So again, you have additional NOx and particulate matters and volatile organic compounds and so forth, and methane in addition, which is a very potent greenhouse gas emitter. Now, for the transport, the CO2 is turned into liquid CO2 at high pressure. It's highly pressurized, and they will need a new set of pipeline that has to crisscross the countries because these pipelines, existing pipelines, are not good enough for carrying CO2. So if there is any rupture, which actually has occurred in Mississippi already, there will be this heavy, because CO2 is actually heavier than air, there will be this cloud that will just kind of hug the ground because it's heavier than air, and it just spreads as far as it can go until the source is actually stopped. So unless you turn it off, you turn off the supply, this heavy cloud is just going to keep moving. And as you know, CO2 is colorless, odorless. As I said, it's heavier than air, but it's an asphyxiant. A lot of people, because we breathe out CO2, don't realize that CO2 is actually very dangerous, but at high concentration causes metabolic acidosis. And at 4%, just at 4% is life-threatening. The other step that CCS can introduce health harms is risk of earthquakes. As you know, with fracking, there is a risk of earthquake because you're injecting liquid at high pressure into the ground. The same problem exists when you try to inject CO2 at high pressure into the ground. And the storage site, you know, again, this is another kind of dream that they're going to be stored in these storage sites that are going to be sealed forever and they're leak proof. And you know, they've done demonstrations for like 2 months or so, but that is not something you can rely on for hundreds of years. So in summary, CCS is a false climate solution, does not eliminate or remove any emissions that pre-exist in the atmosphere, is economically not feasible, is very, very expensive. It needs massive subsidies. And if it's not subsidized, the CO2 is used for additional oil production. It has a history of failure. Many projects for CCS and CCUS have been heavily funded, but then have collapsed, great majority of them. It also poses significant toxic hazard, additional risks to surrounding communities. So one of the issues also is that just because of the pipelines that will be going across the communities, it poses risk to water, to land at distant sites. So if you have CCS as one location and your storage site is somewhere else, you're going to be contaminating a massive amount of land with potential hazards that can be toxic to any living creature. And that's the end of my presentation.
Thank you both so much for your presentations and your passion.
And now I'm going to turn it over to Shweta, whose organization has done also similarly tons of work around decarbonization and is really leading. So I will turn it over to you and get your slides up.
Thank you, my co-panelists, for actually setting the frame. And also, I was just telling Jen before this webinar that the best advantage of going last is that you have to speak the least, because most of your panelists would have done the job. So thanks for that. And I just wanted to quickly kind of reflect on work that Healthcare Without Harm has done with the health sector and the health professionals around the treaty. And before I even begin, I think it's important to recognize the stronghold that fossil fuel industry has on our democracy, because despite all these mounting evidence of health impact and destruction and damages, our policymakers are not moving fast enough towards a transition to a renewable energy future. They're still sort of clinging on to this notion that fossil fuels are required for our development. And there's something fundamentally wrong. And this can happen only because this industry is so influential. And all the more reason why health professionals, why civil society needs to come together if we want to have a planet which is healthy enough to sustain us. The good news in all of this dark times is that we don't have to only depend on our elected representatives to take climate action. because they probably might be influenced by the fossil fuel industry. But there is an unlikely leadership coming in an unlikely source, which is the health sector. And health sector is, it has a unique position. It sits at the epicenter of our climate trauma. Health facilities take care of people who have been affected by injured by extreme climatic events, people suffering from respiratory illnesses and asthma because of air pollution, children and elderly who are unable to, their bodies are not able to take extreme heat. Health sector also occupies a unique position in our economy because countries and economies and people spend millions of dollars in the sector, and this is perhaps the only part of our economy which is underpinned with an ethical framework to do no harm. So, health sector has a unique power. And while health sector is at the forefront of responding to the climate crisis, it's also very sobering to understand that health sector itself is a large emitter of greenhouse gas emissions. Our research in 2019 showed that health sector is responsible for 4.4 percent of net global greenhouse gas emissions. And if health sector were a country, it would be the 5th largest carbon emitter. And this is primarily from the energy consumption, from transport, from products manufactured. So what does it mean to do no harm in this scenario? It means that the health sector needs to kick its fossil fuel addiction. And I'm very glad to say that in the last couple of years, we have seen a tremendous momentum within the sector in transitioning towards a sustainable, low carbon economy, which is powered by zero emissions, sustainable management of healthcare waste, low carbon production of pharmaceuticals, sustainable transport, and we have seen this new momentum in the sector. In last year, National Health Services in England committed to moving to net zero by 2045, and we have also now have 63 health organizations representing 14,000 hospitals and health centers in 22 countries who have joined this race to zero. And apart from the sector, I think health professionals also, and Lalita has sort of very remarkably outlined the work that health professionals, the power that health professionals have locally engaging or engaging at regional and national and global level. But health professionals have a very important role in talking about climate change, talking about climate justice, and they're trusted communicators, and they have that power over their patients, their communities, and the policymakers. So last year around July, Healthcare Without Harm sort of came on board with and collaborated with Fossil Fuel Treaty and started endorsing the call for Fossil Fuel Treaty. And one thing that we did, we used this opportunity and used this moment to sort of expand the message around climate change and climate justice and health justice and health equity. And apart from directly taking action as health sector and showing that leadership, we also worked with pollution impacted and fence line communities in lending solidarity. And one of our first sort of events that we did was organize around fence line communities and fossil fuel communities in India, and brought in the whole health context of health impacts of fossil fuel. And as a result, about 30 civil society and indigenous communities in India called for a global treaty on fossil fuel. So that was our first sort of engagement. So in August last year, we made an announcement about our Healthcare Without Harm endorsing fossil fuel treaty. And it was a Twitter moment. We used a sort of a Twitter storm, as we call a 24-hour Twitter storm around it. Our leadership from Healthcare Without Harm sort of joined in. And then we had doctors and nurses and frontline workers from around the world who called in for a treaty. And it was a very successful sort of a social media moment for us. In September, again, we partnered with Climate Action Network South Asia for South Asian sort of solidarity. And on the occasion of International Day for Clean Air and Blue Skies, we basically mobilized the South Asian health leadership to call for move away from fossil fuel in the interest of climate justice and in the interest of reducing air pollution in the region. South Asia is one of the most vulnerable geographies in the world when it comes to both air pollution risk and climate risk. So more than about 100,000 health professionals from India, Pakistan, Nepal, Bhutan, and Bangladesh joined in on a call on the International Clean Air Day for a global treaty. And as a follow-up, what this engagement has led us is a sort of opened plenty of opportunities for health professionals to engage with their regional policymakers. So one of the follow-up events from the September 7th that happened this year, just before the Stockholm Plus conference, was that health professionals sort of invited members of parliament, elected members of parliament from India, Pakistan, and Nepal and Bangladesh to sort of have a dialogue with them as to why members of parliament need to take a decision in phasing out of fossil fuel and why the health community will support them in that decision. And that was an incredible, like, first of its kind sort of a moment where we had this dialogue facilitated, and we hope to see more such dialogues in the coming months. At Stockholm Plus 50, we had health professionals presenting testimonies. We had doctors and lung surgeons presenting testimonies of impacts of air pollution because of fossil fuel exposure on people, on children's health. And we also collaborated with Fossil Fuel Treaty and other organizations in sort of putting together this document, which was released around Stockholm Plus 50 on the health narrative specifically. Our next steps would be to deepen the engagement with the health professionals and focus on building capacity among the health professionals and the health sector in showing that leadership that is needed in sort of being spokespersons in their local levels, in their regional levels, at national and global level. We're working on a coalition in South Asia, and we're coming up with a very exciting training program for health leadership in Latin American region. And finally, my last words here would be that, you know, as health professionals and health sector fighting global health risks and diseases, including outbreaks with pandemic potential, are fundamentally about fighting global change, climate change. And the health sector overall has a very unique opportunity to combat climate change and help people understand that the same pollution that affects people's health are also driving climate change. And the best example is fossil fuels. I mean, Jen mentioned that, about air pollution causing 7 million premature deaths every year. A large burden of that death happens in my country, in India. And it's important, and health professionals have that unique opportunity to educate people about fossil fuels, about its impact on health, and about how it's causing climate change. Health sector and healthcare professionals have a moral, ethical, and an economic power to lead the change. And it's time that we use those powers to demand a phase out of fossil fuel in the interest of health equity, environmental, and climate justice. Thank you.
Thank you so much, Shweta. That was the perfect rousing ending to our webinar, and also really inspiring to show the, in the face of some of these challenges we're facing, how powerful the health sector can be. Very briefly, I know we're a bit over time. I just want to share our next steps. So Jess and Mark both posted a link for the health letter, for the health endorsement letter in the chat. You saw some of those numbers from the other groups. We don't need to get super competitive, but I do think the health community is a very large community. I think that we could get more signatures than the academics and scientists if we really put our minds to it. And so the goal and the plan is to gather signatories, not quietly, but not super publicly. Like we're not putting out press about this health endorsement letter now. We're using the next 2 months to gather signatories, build our numbers, and we would so value your help with that. Signing the letter yourself, sharing it with your colleagues, working with your organization to sign on, because we saw in the Healthy Climate Prescription that having organizational sign-on as well as many individuals was really powerful. And then the current plan is to go public with that letter in September with a big launch. There's lots of things going on. In September, there's Clean Air Day, there's the UN General Assembly. So we're looking for a really powerful moment where the health community can raise its voice. Again, I want to thank all of our panelists so much for sharing your time and your wisdom at all hours in the many parts of the world you are in. And thank you all so much for joining us. And we look forward to collaborating with you in the future.